Knock, knock, knock. Hand hygiene. Hi, my name is Hannah. I'm going to be your nurse today, and we're going to be doing a head-to-toe assessment. It should take 10 to 15 minutes. Does that sound okay with you?
Yep.
Perfect. Can I get your name and date of birth?
Lorraine Workman, 01/22/2005.
Perfect. And are there any allergies that I should know about?
Nope.
All right. On first appearance of the patient seems to have good posture and is sitting upright. I see no lines, drains, or tubes. The patient seems to be in a cheerful manner. How would you rate your pain on a scale of 1 to 10?
0.
Perfect. 0 to 10 is what I meant for the scale, but good job. And then patient seems to have good hygiene and is dressed appropriately for the weather. And then, do you know where you are right now?
Yes, I'm at my house.
Perfect. And do you know what today's date is?
January 25th, 2025.
Yes, correct. Patient is alert and oriented ×3. And upon talking to the patient, her speech seems normal. I see no concerns of slurs or misuse of language. And can I have you smile? Yes. When patient smiles, face is symmetrical. Thank you. And then can I have you pull against me? Now push against me. And then with your legs, can you push like a gas pedal? All right. And then can you push up against me? Perfect. Patient has equal strength in both the upper and lower extremities bilaterally. Okay, and then I'm gonna have you close your eyes and I'm gonna touch a part of you, and can you tell me where I touch?
Left arm. Right leg. Left leg. Right arm.
Perfect, you can open your eyes. Patient has appropriate sensation through both the upper and lower extremities bilaterally. And then next I'm going to check your hair, if that's okay. Patient's hair seems equally distributed. I see no signs of lesions, bald spots, or scarring. I have no concern for alopecia and seems to have good hygiene. When I first take a look at the patient's eyes, I see her eyebrows and eyelashes are full, and I see no patches or like discolorations to them. And then can I have you go ahead and pull down the bottom of your eyelids? Perfect. Patient's conjunctiva is red and moist, as it should be, and the sclera is white and clear. And then can I go ahead and, can I have you look at my nose as I shine this light? Perfect. And then can you follow my pen light without moving your head? All right. And then take a look at my light and then look at the wall. Perfect. The patient's pupils are equal, round, and reacted to light and accommodation. And then I'm going to go ahead and take a look at your ears. And the other one. Patient's ears are an appropriate size and shape for body, and I see no discolorations in them and no drainage is present. And then can I take a look up your nose? You can look up for me. Perfect. And then can you close one nostril and blow, and the other one? Okay. Patient nares are patent, and I see no drainage, papules, or signs of a deviated septum. And then can I have you open your mouth for me? Perfect. Patient's mucosa is red and moist, as it should be. I see no lesions or wounds inside. Patient has good dentation and oral hygiene. I see no concerns for cavities, and tongue is midline. Okay, perfect. Next, we are going to do your cardiovascular assessment. So can I, let me put this in. Can I see your fingers to check your capillary refill? Perfect. And then can I take your shoes off for me? Perfect. Capillary refill was less than 3 seconds. And then I'm going to take a listen to your heart. patient's heart sound is normal, and the rate is within 60 to 100 beats per minute. And I hear no signs of S3s, S4s, or murmurs. Can I go ahead and check your pulses? Can I have you flip over your wrist? Perfect. And then can I check your pedal pulse? Have you take your shoes off? All right, perfect. Patient's pulse rate is 2+ strength and equal bilaterally through both extremities in the radial, brachial, and pedal pulses. And next, can I have you look up and to the left? Perfect. I see no signs of JVD present, and then you're good. And then I'm going to go ahead and palpate your carotid artery. All right, and then I'm going to take a listen to it. Patient's carotid artery has equal strength. I feel no thrills, and there's no signs of bruit present. Okay, next we're gonna do your lung assessment, and on first inspection of the patient, they seem to not be in a labored breathing, and their chest expands equal bilaterally. I see no signs of barrel chest or intercostal retractions, and the patient's respiratory rate is between 12 and 20 breaths per minute. All right, I'm gonna go ahead and take a listen to your lungs. So when you feel my stethoscope, can you take a deep breath? All right. All right, and then can I have you lift your right arm for me? Take a deep breath. Perfect. And then can I have you turn around? Perfect. And then again, take a deep breath when you feel my stethoscope. All right, perfect. You can go ahead and turn around. Patient's lung sounds are clear, and I hear no signs of crackles, rhonchi, wheezes, or stridor. And the lung sounds were equal bilaterally through all lobes. All right, and then next we're gonna do your abdomen. Oh, are you having any cough? No. Okay, perfect. Patient states that they do not have a cough. And then we're gonna do your abdomen assessment. So I'll just ask you a few questions, and then I'll have you lay back. When was your last bowel movement?
Yesterday.
Okay, was it like a normal color, odor, consistency?
Yes.
And is your bowel pattern pretty normal?
Yep.
All right. And then when was the last time that you voided?
Like 30 minutes ago.
Okay, was the color consistency the same for that, and odor?
Yes.
All right, have you been experiencing any urgency, frequency, or retention with that?
No.
No, okay, no concerns with either? Okay, perfect. And then I'll go ahead and have you lay back. All right, upon the first, upon the first inspection of the patient's abdomen, it is flat, non-distended, and I see no visible masses or pulsations. I'm gonna go ahead and take a listen to it. Patient's bowel sounds are equal and reactive and can be heard in all 4 quadrants. I'm going to go ahead and palpate it. Will you let me know if there's any pain or tenderness with it? No pain or tenderness? Okay. No, there was no guarding or rebound, and there were no masses felt. You can go ahead and sit up here. All right. Next, I'm going to assess your range of motion. So I'm going to place my hands on your shoulders and have you move them. So can you move your arms to your side? All right, in front of you. And then now up. Perfect. And then can I have you put your arms out like this? And can you bend your elbows? All right. There's no crepitus heard or felt in her upper extremities. And then I'm going to have you do the same with your knees. Can you straighten them? All right. And then put them back down. And there was no crepitus in the lower extremities either. And then can I have you turn your head to the left, to the right, up, and then down. Patient has full range of motion in the neck and upper and lower extremities. I'm going to go ahead and place my hand on the back of your neck and have you again turn to your left and then to your right. All right, no crepitus was found in the neck. And then can I have you shrug your shoulders? And patient has adequate movement of their shoulders. I'm going to go ahead and have you walk to assess your gait. Can I have you walk to the chair? And then heel to toe walk back. Perfect. And then you can go ahead and sit down. Patient has appropriate gait and also has appropriate balance and coordination. Next is your skin. The patient's skin is appropriate color for the ethnicity. I see no discolorations, wounds, scars throughout. And then can I go ahead and feel your temperature? Perfect. Patient's skin is warm, dry, intact, and the temperature is equal bilaterally throughout the upper and lower extremities. Okay, and then I see no signs of edema. And then can I go ahead and check for turgor? Perfect. No tenting was present. And that concludes our assessment. Thank you.